Hi everyone, this is Shubh Singh. I'm attending the CIO 100 Awards at the beautiful Broadmoor Resort in Colorado Springs, Denver. I'm attending this event as a part of the Maryland Health Benefit Exchange team, which has been recognized by the awards. And I am very happy to spend some time with the Executive Director for MHBE, Michele, Eberle, and also the CIO, Venkat Koshanam. First of all, congratulations on this wonderful achievement.
Thank you so much.
And Michele, to start with, could you tell us a bit about yourself and also about the exchange, the work it's doing, the impact it's having?
Oh, I'd be happy to. I will date myself now because for over 30 years I've been in the insurance industry in leadership positions. I also have a background in IT, so this has been particularly fun for me to get back into IT circles this week at this symposium. The exchange has been just an exceptional part of my career path. We are the state-based marketplace for Maryland, and our mission is to make sure that every person in Maryland has access to healthcare, has access to affordable insurance, and we've done particularly well on that. And we've been able to do that partly through our innovation and technology, through our marketing efforts, and through just a commitment by the state of Maryland to get people health insurance and to get people covered.
That's wonderful. And Maryland actually has 1.3 million customers, I believe,
Yes,
right?
we do.
Yeah, so a lot of people may not know, but even in the space of health insurance exchanges, but Maryland handles all the MAGI Medicaid enrollment and all the health plan enrollment under the ACA.
Yes.
Venkat, could you tell us a bit about yourself as well, please?
Yeah, thank you, Shubh. It's a wonderful time here, and it's a great honor for MHBE to be recognized as one of the top 100 IT firms to win this prestigious CIO 100 award. And I'm really thankful for my wonderful team. And our team consists of more than 150 staff in-house IT. We pretty much support everything for our exchange with respect to information technology. It includes our operations, security, infrastructure, and our programming and our development and testing and quality assurance functions. And also we have a niche unit called special projects where we do a lot of innovation and we bring in new products into the market. We support new initiatives of our executive director and our policy initiatives, etc. And our team is a great team, and I'm very happy to be here.
And Venkat and Michele, technology plays a big role in the exchange, doesn't it?
Absolutely. It's the foundation for what we do. So of those 1.2 million people we spoke of, they all come through our system, Maryland Health Connection.
Okay.
And that is the backbone of what transmits all the enrollments to our insurance carriers. We communicate with the federal government, with the state government. So it is the backbone of what we do.
Sure. And Venkat, I think Maryland's very unique in having a mobile platform as well, a very customer-centric mobile platform in addition to the website.
Yes, absolutely. One of the decisions that we made a few years back is to offer a mobile platform to the consumers. It's partly because that is where the trend is. We do see more than 60% of our traffic coming through our mobile devices. So it made all the sense for us to invest in building a mobile platform and getting to our consumers through mobile devices. And currently we have iOS and Android options. And our consumers, we increasingly see use mobile functions for very interesting ways to quickly look through the price, premium, what they would have to pay, what is the benefits they would be getting, what would be the subsidy they would be getting, and to log into our mobile device account and probably upload a document that they need to submit in order to get the final verification, for instance. And so there are a lot of unique ways. For instance, the GPS capability can be used for consumers to locate the nearest available broker for them to help with. So mobile is a very important component of our exchange, and we do serve end-to-end from the consumer seeking the price until they do the plan.
So there's full enrollment as well on the mobile platform.
It's completely integrated on both Medicaid and QHP and dental insurance coverage as well. So overall, it's an exciting, technologically, it's an exciting components that we have. We do constantly look for more modern technologies, more solutions. We go for open source technologies. cost-efficient technologies where we can support. Our team has the capability to support all these new technologies. We swiftly moved away from legacy technologies and adopted a new technology. In fact, in a couple of weeks back, we moved to Amazon Cloud. So, as you can see, we do very rapidly evolve.
There's a lot happening at the exchange.
Yes, absolutely.
Yes, it's just amazing how much is happening. Yes.
And if I might just
yes.
add a couple points onto the mobile application, because not only is it technologically innovative for Maryland, but what it has done from a policy standpoint and from getting people enrolled is that we have found that we have 60% of our users are young people when they're enrolling in the qualified health plans. And what that does in the insurance market, it brings young, healthy people in, and that helps drive down the cost of premiums. So it's very significant.
Yes.
And for our Medicaid population, we find that there's many people that don't have access to computers to do enrollment, but most everybody has a cell phone. So it's been significant in getting enrollments for that population as well.
Thank you for sharing that. That's a great fact to share because I work extensively and I have been for many years with states. And one of the questions they always ask is, what's the penetration of mobile phones in the Medicaid population? So it's just great to see Maryland, have information on that and take full advantage of that and serve that population so well. And what about the award? So tell me a bit about the projects that have been recognized by the CIO 100 award.
Yeah, it's very exciting because our core IT goals, we found that is very interestingly aligned with what CIO 100 was looking for in many ways. As for our core IT goals, we do obviously want to implement all the enhancements, policy changes requested of us in a very agile, very timely way. But we do also want to have a modernized technology that can be cost efficient and at the same time don't let us behind. We do like to be on the upfront on the curve. And in fact, our agency's IT, our technology is number one among the state-based marketplaces. And with respect to CIO 100's recognition, CIO 100 quoted as digital transformation.
Yes.
And that's exactly what we did, and which includes our mobile application, developing enhancing our mobile applications, and doing an end-to-end, providing support to our consumers in seeking the coverage and supporting posts, supporting the coverage, and in converting our legacy website into more responsive site, and also integrating our platform with our call center application, which is a Salesforce platform, to providing customer support services, and thereby reducing our call handle time, our call volume in some instances, and even simplifying how the consumer could even reset their password or things like that. We did see that an enormous amount of calls reduced across the country for various reasons, but technologically, it did our new technology, our legacy, removing the legacy technology and improvising the platform, supporting them operationally, and improvising our overall operations of the exchange, did help consumers in not seeking to call us for those things. Our call, as we understand, the call quality has been a lot better. There was a lot of initiatives that Michele can talk about in terms of call center improvements. However, from the technological point of view, the moment you don't have issues with your applications, the consumer's frustration already goes down, and the calls would be different. The calls may not be, hey, I'm not able to reset my password. It will be, how do I get coverage under this specific family conditions? So I think we are at that transition right now, and our technology has greatly helped and is continued to help our exchange in helping our consumers more engaged with us in seeking the coverage rather than suffering through the process of getting the coverage.
And I'll provide an example of that. So 3 years ago, maybe 3.5 years ago, when someone called the call center, it would take about 21 minutes to handle the call. Between the system improvements, the integration of our HBX systems, which we refer to it as, with the telephony system and with a CRM system, customer relationship management system, we now provide that same delivery of service in 9 minutes.
Wow, that's
So
amazing.
from 21 minutes down to 9
That's
minutes.
amazing. That's an amazing statistic.
And that's in 3 years.
Yeah. And the theme of, or the slogan for CIO 100 this year is the innovation conversation. So I'm sure they're recognizing the innovation that's constantly been happening at MHBE. And it's so wonderful to see MHBE get this recognition, because Maryland Health Benefit Exchange right now is a leader in the space, is recognized for innovation, and is really a pioneer in so many ways. But I've been working with health insurance exchanges since 2012. I'd led the implementation of the Connecticut Health Insurance Exchange originally at that time, and I've seen a lot of struggles along the way. So I wanted to ask you about the journey as well. Could you share a bit about the journey of MHBE and the struggles you may have gone through, and how did you reach this position of leadership today?
Well, I've been with the exchange since 2013, so not from the very first day, but pretty close. Was there when we opened up on October 1st of 2013 and failed miserably. Through a lot of pain. It was a very painful time because we could not deliver to our consumers a product that we wanted to get them, which was enrollment in healthcare coverage. The resiliency of the exchange, which has been throughout, was that in spite of the system failing, we went back to manual methods and still got people. So that was good. But where we've come from, the journey for the exchange from that moment in time to where we are today, is just night and day. We've built an incredibly solid team, innovative team. We greatly support the leadership team. Very much supports innovation, supports bringing new ideas to the forefront, so we can innovate and we can be creative. For myself personally, when I started at the exchange, I was actually the executive director for the Maryland Health Insurance Plan.
Sure.
And I was doing a dual role as director of plan and policy management, so I had two hats. Then moved into the role of chief operating officer of the exchange, and then almost 2 years ago became the executive director.
Sure.
And it's just such a pleasure to be the executive director of this agency and to have a leadership team of Venkat and my other 8 folks on the leadership team with us. And we're doing great things, and the bottom line is everyone is committed to our mission of really helping people in Maryland get health care and be healthy. And that's what we're trying to do. So in addition to the technology, we're using that technology like the marketing platform, which we built, to really help with shape human behavior around how they use healthcare. So for instance, people say all the time, I have a health plan, but it's too expensive. I can't use it. I don't use it. My deductible is too high. And what we're going to do is use that technology to push something out through the marketing portal to say to the consumer, your 50th birthday is coming up in a month or two. Did you know you can get a free colonoscopy screening before your deductible? Go get that preventative screening.
Right.
So that's really a very impactful way to help shape the health of Marylanders.
It's amazing because the systems that Maryland, both business and technical systems you've implemented, you're able to directly communicate with the consumer, right? So it's direct to consumer marketing, which is just striking for me. Also, what's so striking for me is the resiliency of the leadership team, because Maryland rebounded so well from that first year to the next year, and then you never looked back. So could you talk a bit about some of the upcoming initiatives? Because I know there's a lot more happening at the exchange.
Well, as I said, we are always opening up to staff, and Venkat supports us as well, of what are some new ideas that we can look at. So from a technology standpoint, and I'll let Venkat talk more about that. From a policy initiative, one of the things that we are doing is, again, trying to solve a need around small businesses that need health insurance. So we found that particularly those employers that have 15 and fewer employees have really been left out of the insurance marketplace. And last year we had some chambers looking to see what can we do legislatively to help solve that problem. And when we heard about that, we thought, well, we have the solution. We just need to connect with these small businesses. So we put this year has been a very strategic initiative on connecting with small businesses, using chambers, using associations like the Maryland Realtors Association, and letting them know what we have for our small group marketplace. We will be building it into the HBX system, Maryland Health Connection system, so we'll be able to use all the benefits that we already have
Right.
developed. And we're also looking legislatively at some federal action that might help us get some premium relief
Sure.
to these small employers. So that's pretty neat.
Right.
Excited
So
about
the
that.
brand new shop platform coming up
Yes,
soon.
that's right.
That's amazing. And Venkat, what about from technology perspective? Any technology initiatives you'd like to talk about?
Yeah, to add to Michelle's point,
Yes.
summarized very nicely with respect to the journey, the mode where we were in before was on firefighting mode. So exchange is there, consumers are there, but how are we connecting to them? And they are not able to get the coverage they want. They are not able to use the system in the way it's supposed to be functional. From that was the stage several years back, and from there it transformed into a phase of an operational exchange, and an exchange that can provide the support consumer requires, and mostly electronically through our technology, and supplemented by our call center and other functions. Several of them could be manual functions too. And from there, we transformed into where we are today is how do we have a technological innovation that can, as Michelle pointed out, that can have a new platform itself that would drive consumer growth, that would provide the consumers the benefits that otherwise they are not getting currently. And that would also, with respect to the marketing portal, where our marketing team can directly engage with the consumers for a variety of situations. So from where we were on a firefighting mode to an operational mode to an
Yes,
innovative mode,
innovative mode, yes.
is a very incredible journey. And technologically, that's what we look for, our teams and our skill set that really support this. And for example, the special project is complete blessing from Michelle and our leadership team, where we try to invent things out of the box,
Right.
out of the box, and try to get solutions, learn new things, and
So, for
implement
example,
those
you're
ones.
using artificial intelligence as well, right? In the chatbot.
Absolutely, chatbot is a great example that you
Yes.
brought in, and that's an AI. Our first venture into AI.
Sure.
Obviously, we would like to see a lot more than that,
Right.
and our next year goals are it's pretty daunting right now. Implementing a robotic process automation into our operations, for instance, or using an OCI technology.
Yeah, OCR for the mobile app. I think
Mobile app.
mobile OCR is coming out soon, and then also security with the biometric security.
Security as well. And also, if we can somehow automate the verification of
Yes.
certain consumer documents, for example, immigration document verification, we can, even if we could automate 20% of them, that 20% is a workload we're taking out of the workers, and the cost it saves, and the amount of manual repetitive process it avoids, and also the security it provides in terms of the genuine verification of those documents. That really helps us stay in compliant with our requirements, and helps us with our audit requirements as well. So it's a, like Michelle pointed out earlier, it's an amalgamation of a lot of things.
Right.
It's not just technology, but how technology goes hand in hand with our marketing, our compliance, our legal, our policy, finance. So we do have a wonderful way. Finance, I just said, because we have a wonderful procurement model as well, which we are blessed with to have. So that really helps us to hire our resources, who need to have specific skill sets, and we can hire them rapidly, and we cultivate the team. And Michelle is very particular about the culture of our organization.
Sure.
It's a very open, very challenging in terms of folks who really want to take up those challenges and excel in them. Yeah, we provide those opportunities, and we have the great work-life balance, and technologically we have all these tools available for the team to work on. And we have very clear direction from our leadership team and also from our technological leaders that drives all these solutions. And we do a very rapid deployment of our releases. So every month we have a major release, and we have implemented all the processes that are industry calls agile. We implemented a version of agile to meet our demands. So it's overall we're in a great shape, and the next level is to look for more and more innovation and thrive on innovation and support our consumers, support our leadership team and getting the consumer engaged with us more and get the enrollments growing.
And Michelle, I've seen organizations, and you read about them, how business leaders are sometimes daunted with so much technology coming in, but looks like you're really embracing technology. So could you talk a little bit about, your thoughts on that, and the business team that's reporting to you, their thoughts on it?
Sure. I mean, it may help that I have an IT background,
Sure.
so it's not foreign to me. But everything we do touches technology.
Right.
And even as Venkat was saying, with the uploading documents that will prevent us having a privacy breach. So that's compliance, our compliance team. All of the functional areas within the agency rely on technology.
Right.
I think it may have taken a little time, but I think every segment, every little functional area within the agency really supports technology. And by that I mean not only for the consumer facing, but we use technology for our internal. We are going back to compliance. We're building something for the compliance team, for the HR team, for finance team. So things that will help improve their workload and their day-to-day operations. So I think everybody really sees the value of that, and not only in technology, but in how our consumer assistance and how we can use technology and other methods to really support those folks out in the field helping consumers. But as Venkat said, culture is very important to me, and part of that is being open to new ideas and growing and embracing it and trying it. And some may not work, and some will work great, but we won't know unless we try.
Well, it's just amazing seeing Maryland, MHBE constantly innovating and doing just so much. Thank you so much for your time, and thank you for all the fantastic work the Exchange is doing in serving the people of Maryland. And congratulations once again on this wonderful achievement.
Thank you so much.
Thank you.
Appreciate it.